see how this administration of President Bola Ahmed Tinubu will be looking at improving the healthcare in Nigeria. And I have joining me through Skype this morning, Grace Tabo of Alliance Hospital. If you can hear me, very good morning to you, Doctor.
Good morning. Thank you for having me.
All right, I understand that you have a very busy schedule this morning, but we'll just go straight to the discussion. I want you to give us an overview of what you think this administration may be doing at health care, because we see that nothing much has been said in that regard, since we have issue of fuel subsidy and trying to put the economic back in shape, and the health sector had its own share of problems. I don't know if you told the same line with so many Nigerians that nothing much has been said about the health sector by this administration.
Yes, that's correct, because other issues have been taken there with the current administration, like the fuel subsidy removal and the handling of the foreign exchange and security issues and all that. So the health sector has really not been in focus. Nevertheless, there are a lot of big issues in the underbelly of the health sector. If I don't know if you are aware, the resident doctors just came back from a 2-week long strike, and the issue of the exit of professionals, doctors and nurses. 2,000 doctors leave Nigeria every year to go abroad to get job in greener pasture, as they call it. And we only graduate 3,500 doctors in a year from all the medical institutions, all the medical schools across the country. 3,000 to 3,500 graduates, and of that number, 2,000 of them leave the shores of this country. About 60% of the people who graduate, they leave. And because of that, there's scarcity of doctors now in many of the big teaching hospitals. They advertise for vacancies to fill up spaces. And I mean, nobody shows up. Very unlike some 10, 15 years ago, when people are scrambling to take up the spaces in the for residency training program in teaching hospitals. Now, teaching hospitals are begging doctors, please come. Whether you have even written your primary exam or not, just come. We want to take you, but nobody is there to fill the space, because 90% of all the graduates that we have in Nigeria now, they are on their way out. So there are two types of Nigerian doctors: those that have left and those that are waiting to leave. So that's a big issue, because it's borders on human resource for health. Without human resource for health, you cannot even begin to discuss the health sector, because even if you have all the machines will not treat patients in themselves. It's people that will treat patients. Then also, you cannot also separate the current prevailing economic situation from the health of the people. People are impoverished as we speak. The fuel subsidy removal, coupled with the escalating value dollar and the unemployment, they have cooperated to really frustrate most Nigerians. The middle class, as we speak, is even being wiped out. So we have just the very rich and the very poor. And of course, the very poor are in the vast majority. Many people are falling into poverty. And don't forget that majority of Nigerians, they spend on their health from their pockets, because health insurance is not entrenched in this country.
Well,
when simple disease like malaria cannot be treated because someone does not have 3,000 naira to seek health care, that becomes a disaster waiting, and a lot of people are dying from treatable medical conditions.
All right, I don't know where we got it all wrong, because this is not the first time we are hearing of doctors leaving the shores of Nigeria for greener pastures abroad. And then the health sector administration did several promises actually worked on this, to having a recurrence of issues. At what point did Nigeria get it wrong? Is it through our training institutions, the lack of political will to have this health sector in the right perspective?
You see, there are the pull and the push factors when it comes to movement of professionals, particularly doctors. The, the push factors are the things that are pushing them out of the country. If you go back history, in the 80s, when the military government came and there was political instability, from early 80s into the mid 80s, something like this happened. Nigerian doctors and nurses were leaving for Saudi Arabia and other Gulf states. Why? Just because the value of the naira at that time was at a very low ebb. And now it is happening again because our currency has been bastardized and the economy is not in a good shape. And doctors will tend to gravitate towards the place where they will get value for their service. So that's why there's a surge. All over the world, there are movements of professionals. Even doctors are moving from the UK to the US and all that. But when you find yourself in a situation where every single doctor in the country is either left or planning to leave, that's a disaster. And I can tell you, a study was done. 90% of young doctors want to leave the country. Whether they will eventually be able to leave or not is another thing. But the very fact that they wants to leave, and 60% of those who graduate every year are leaving, that gives any government a big headache. Unlike what the former Minister of Health, of Labour, Dr. Chris Ngigi said. He said we have surplus of doctors there, and position because right now the country is bleeding in terms of human resource for health. Not just doctors, nurses. Plus nurses leave every year, and only 14,000 nurses are trained in the country. So we are preparing them for abroad. So those guys, they are getting cheap labor, and it costs a lot of money to train these guys here. Institutional memories in many hospitals are being wiped out because even the senior consultants are leaving. So what you are going to have is a weak medical system. That's just one of the problems. There are many other problems. The purchasing power of the people, infrastructure, the hospitals, a lot of government hospitals are just an eyesore because there's no funding. Funding is poor. The budgetary provision for healthcare, the African Union, the Abuja Plus 12 declaration, all governments of the African countries agreed in 2001 that 15% minimum of national budget should be on health. But we have not been able to come close to that at any time since that time, over 20 years. The highest that we've gotten is 6%. And as insurgency and other security issues begin to push itself into our national space, it takes a large chunk of the budget, and we are left with health is no longer priority, and so you have healthcare now being sidelined, and that's taking a toll on the people. And that's just a matter of prioritization. I hope that this new government will give a bigger priority to healthcare.
All right, let's set an agenda for this new government, just like you said, giving a priority. If you're to advise the administration of Bola Ahmed Tinubu as regards the healthcare sector, what will you be telling him for us to set this thing settled for, at least for a while? Maybe I'll have our doctors stay back here to attend to patients in Nigeria.
Thank you. Everything starts with leadership. The first thing is to get the leadership right. Put square peg in square hole. People who are passionate, people who know what the standard should be. Talking about the Minister of Health, I'm happy with his choice of Dr. Salman, a fine lady, brilliant lady. I've worked with her before. that was appointed as special advisor on health. I think that lady will bring a very great value to his administration in terms of health. Then he should get the minister, and then from there, the leadership trickles down to the grassroots. That's one. Then secondly, budgeting for health. It's very important to give a good chunk of the budget to healthcare, and they should explore the possibility of public-private partnership. I know there's a department of PPP in the Federal Ministry of Health, but I think that department is not playing a prominent role as it should be playing. There's a lot of funding in the private sector. If government can give leadership in that direction, they can mobilize quite a huge money private sector into healthcare. But there has to be a promise. There has to be clearly defined benefits for the players. And then the National Health Insurance Scheme is a very big opportunity to leapfrog our healthcare system if it is well managed. Over the years, the people who have managed that department, they probably don't understand how it should work, or whether it's the complication of the
Dr. Tabo, if I can get you there, I believe that should have been your last for this morning. Most thank you so much for your time with us this morning, Dr. Tabo from the Alliance Hospital.